Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic.
Let's go to London and speak to TRT World's health correspondent, Nicola Hill. Nicola, you filed a package for us, a report earlier this week, which contained a clip of an epidemiologist from Oxford University who supported the idea of herd immunity. I haven't heard too many scientists say that it's a good idea.
No, this was something to do with the article called The Great Barrington Debate. This was published last week on a website set up specifically to argue in favour of herd immunity. And yes, you're saying Professor Gupta, who's a professor of theoretical epidemiologist, is one of the people who is advocating that, along with various other scientists. They said they had something like 6,300 signatories supporting them, but they had some very weird names on those signatories, including supposedly the health minister here in the UK, which completely wasn't true. So this latest letter that's been published in the medical journal The Lancet by 80 scientists, now this is called the John Snow Memorandum. It's arguing against herd immunity, and it's called that not because of Game of Thrones, but because it's named after one of the leading scientists who discovered the fact that cholera was spread by water. Now, what they're arguing is, as you've just quoted there, that basically herd immunity is a dangerous fallacy. Their exact words are, uncontrolled transmission in younger people risks significant morbidity and mortality across a wide population. And they're arguing that, for a start, we don't know about the immunity with the coronavirus. We've been reporting just this week on one case where a man got a second infection and was more seriously ill. If that's the case, I mean, it's rare. We only know about 5 so far with like 38 million cases. But then Dr. Simon Clark from Reading University has said that there might be many more reinfections that we simply don't know about because they were mild, but they were reinfections. So that means that, long-lasting immunity might not be a possibility. You've also got long COVID, which we've talked about, where you've got young people who seem to have no underlying health conditions, then becoming ill for months. And then just on Monday this week, we reported on volunteers to the CoverScan study, many of whom were asymptomatic but had tested positive for COVID-19, had their organs scanned as part of this study, and half of them showed signs of organ damage. So all of these are the reasons why these scientists who've signed the John Snow Memorandum are saying that herd immunity is completely impossible. And instead, what governments should be doing is setting up much better systems for community transmission to be controlled and protected, things like isolating, test and trace. We know that in countries like here in the UK, that's not been very successful, but countries where it has, Japan and New Zealand, they've got much better control of the virus. So they've set up this John Snow Memorandum and they're asking everyone to sign it because they really do believe that herd immunity is a fallacy.
Nicola, thank you. As always, Nicola Hill, our health correspondent in London.